Introducing the StatLock PICC Plus Stabilization device, designed to improve patient comfort and safety by eliminating the need to suture secure PICC and midline catheters. Clinical studies indicate that the StatLock PICC Plus Stabilization device increases average catheter dwell times and prevents accidental needle sticks, as well as reduces unscheduled restarts, catheter complications, and overall costs. The StatLock PICC Plus Stabilization device is an evidence-based method for catheter stabilization that meets the 2006 INS standards. In fact, OSHA also recommends consideration and implementation of available, effective, and safer medical devices to reduce the potential for needle sticks by eliminating the need to suture medical catheters. So watch and listen to this brief instructional video. The few minutes you spend now will allow you to become StatLock device proficient. Application of the StatLock PICC Plus Stabilization device is as simple as prep, press, peel, and place. Once the winged PICC or midline catheter has been placed according to manufacturer's directions, identify the targeted securement site. Notice that the securement site and the insertion site occupy two distinct locations. Care of the catheter insertion site does not change with the use of the StatLock device and should always be in accordance with your institution's policy and procedure. Preparation of the StatLock device securement site should proceed as follows. First, prep the entire securement area with 1 to 2 alcohol pads in order to cleanse and degrease the skin and to remove any betadine, oils, or lotions if present. Allow to dry completely. Second, and very important for skin protection and enhanced adherence, apply the provided skin protectant pad and allow it to dry completely for 10 to 15 seconds. The StatLock device securement site preparation is just this simple. First alcohol, then skin protectant. Finally, remember when using each product, allow each to dry completely. If you have the StatLock PICC Plus device with fixed posts, simply place the catheter suture holes over the posts and press the clear StatLock device lids closed, one side at a time. If you have the StatLock PICC Plus device with sliding posts, first place one of the catheter suture holes over either of the posts. Then slide the catheter and post toward the second post until the suture hole fits over it easily. Now press the StatLock device lids closed, one side at a time. Always connect the catheter to the StatLock device before adhering it to the skin. This way you'll avoid excessive pressure on the patient's skin. Now simply peel away the StatLock device paper backing one side at a time and place the StatLock device anchor pad over the prepared securement site. A transparent dressing may now be applied either up to the StatLock anchor pad or covering the pad entirely. Prep, press, peel, and place. Application of the StatLock device is that simple. Before removing the StatLock PICC Plus Stabilization device, remove the overlying transparent dressing. To do so, use the stretch technique. Always work from the distal portion of the catheter toward the insertion site to avoid pulling the catheter. In order to stabilize the catheter and prevent migration, you may wish to leave a strip of transparent dressing over the insertion site. Or if you choose to remove the entire dressing, simply apply a gloved finger to the catheter near the insertion site. Use either method to maintain the catheter's position throughout the StatLock device removal. You are now ready to remove the StatLock PICC Plus Stabilization device using a simple two-step procedure. Just disengage the catheter and dissolve the adhesive. Before opening the StatLock PICC Plus stabilization device, first stabilize the catheter. Then with the other hand, lift one edge of the lid and it will open. Repeat the procedure to open the other lid and lift out the catheter. All StatLock devices have a custom formulated adhesive that is alcohol soluble. Therefore, to remove the StatLock device anchor pad, simply take 3 to 4 alcohol pads and squeeze a generous amount of alcohol near the edge of the pad. Then lift the edge and continue to stroke the undersurface with alcohol while gently lifting. Disengage and dissolve. Depending on your preference, you may choose to dissolve prior to disengaging. Removing the StatLock device is that simple. Now let's consider frequently asked questions about the usage of the StatLock PICC Plus stabilization device. Listen closely, as these 5 points are guaranteed to benefit both you and your patients. We use betadine as part of our insertion site prep. Can we place the StatLock device on top of the dried betadine, or should we remove betadine when preparing the StatLock device securement site? Betadine dries as a powder and interferes with the StatLock device's adherence. Therefore, always remove betadine with alcohol. Then apply skin protectant to the securement site and allow each to dry completely. PICC lines often ooze for the first several hours. Should the StatLock device be applied immediately after a PICC insertion or after the oozing stops? Apply the StatLock device immediately after PICC insertion to prevent accidental dislodgement or catheter migration. If oozing occurs after insertion, apply a 2x2 gauze over and/or under the catheter at the insertion site. Some clinicians apply a gentle pressure dressing. What if blood or betadine gets on the StatLock PICC Plus device anchor pad? The StatLock device anchor pad is made of closed-cell foam and will not absorb fluids. If you wish to clean the pad, do not use alcohol. Instead, use sterile saline or hydrogen peroxide and gently blot the pad. What if the PICC catheter does not have wings? Can I still secure it with the StatLock PICC Plus stabilization device? Some manufacturers include a soft attachable wing in the catheter kit. If this is the case, simply secure the soft wing to the catheter and use the StatLock PICC Plus device as instructed. If no such attachable wing is available, use the StatLock IV adult stabilization device to secure the catheter. I want X-ray confirmation of the catheter tip position prior to affixing the StatLock PICC Plus stabilization device. This often takes time. What do I do in the meantime for catheter fixation? Many clinicians do the following. Prep the securement site. Press the catheter into the StatLock PICC Plus device as instructed. Then expose only a small portion of the StatLock device adhesive and place it on the skin to secure the catheter temporarily. Cover with a gauze and transparent dressing and obtain the X-ray. Once the catheter's position is confirmed, remove the overlying transparent dressing and gauze. Notice how the gauze prevents the transparent dressing from adhering to the StatLock device. Now, reposition the catheter and the StatLock device as appropriate. Then peel away the paper backing and place the anchor pad firmly on the securement site. What if I wish to place a PICC line all the way into the hilt? Will the StatLock PICC Plus stabilization device still work? Notice that the StatLock PICC Plus crescent pad is designed with a notch on top. This notch allows you to place the StatLock device extremely close to the insertion site. But remember, the StatLock stabilization device increases the average PICC catheter dwell time. The few millimeters of additional catheter exposure, which the StatLock device may require, are far outweighed by its clinical and cost benefits. I worry about pistoning of PICC lines placed in the antecubital vein. Can the StatLock device help to alleviate this problem? Remember, pistoning is primarily a consequence of the catheter's point of entry. Nevertheless, the StatLock device can help to alleviate in and out motion of the catheter. Either place the StatLock device on the diagonal from the insertion site, or form an S with the catheter leading from the insertion site to the StatLock securement site. Both methods serve well to limit catheter motion. How long should the StatLock PICC Plus stabilization device be left in place? The StatLock PICC Plus stabilization device is designed to secure PICC and midline catheters for up to 7 days. So clinicians generally change the StatLock device when they do their weekly insertion site care. However, if your institution's policy requires more frequent care, you may allow the StatLock device to remain in place during interim dressing changes. Again, the StatLock device need only be changed weekly. What if the transparent dressing adheres tightly to the StatLock device lids? How do I remove it? Before removing the transparent dressing, apply alcohol to the dressing where it contacts the StatLock device lids. This will allow for easy removal. Thank you for taking the time to become StatLock device efficient. Now your patients can benefit from StatLock stabilization devices, designed to improve patient comfort while you enjoy greater safety. The StatLock PICC Plus stabilization device is faster, easier, and safer than tape and suture securement.